So we're going to leave the brain again and go back down to the cervical soft tissues now and talk about the larynx. So we're going to look at a little bit about imaging techniques and look at the important anatomy around there and then look at pathology. So the larynx and the hypopharynx are down in the visceral space. So remember, again, we have the hyoid separating the neck into the suprahyoid and infrahyoid portions. And the visceral space here in front, we've got the thyroid, the parathyroid. We have some nodes, those strap muscles, and we also have the larynx and hypopharynx in that area. So briefly about imaging techniques first. Again, we can do a CT straight through the cervical soft tissues, but we sometimes add other things. One is just doing a quiet respiration and a breath holding. So we see how the vocal cords move to midline if we do a breath holding with the patient's mouth open. Interestingly, if we do a technique called the puffy cheek that we use a lot in the oral cavity, if we scan the patient while they puff out their cheeks, we can see the inside lining of the buccinator in the cheek better. The tip of your tongue actually moves away from the mandible if you try to do it yourself, and we dilate up all these air-filled spaces. So the retromolar trigone and a lot of the air-filled spaces of the larynx all dilate up if we do that. So sometimes if we ever look at a patient and we're suspicious of those areas, we can do a thin second pass through that area. If we do a quiet respiration or breath holding with your mouth open, then the cords will go to midline, and we can see if the cords are moving or not. So this is a second pass we may do through that area. If we do that puffy cheek, all the air-filled spaces that we talk about in the throat are all going to dilate, so we can do a thin stack through there. And we know if we angle the scan roughly to around the C4-5 disc level, then we're closer to getting a cut through the vocal cords. Otherwise, we're scrolling up and down, and we know that the anatomy may be a little bit off